You have to hire nurses that are reliable. You have to review resumes and look at previous places they've worked. How long have they stayed there? You have to call references. That is one thing that I did not do. Hi, guys. Welcome back to Pivot and Profit with Priscilla. So today I want to talk about how I started my $1 million pediatric home healthcare agency. In a previous episode, I kind of discussed my journey to get here. I started by letting you guys know that the first home healthcare agency I actually purchased was a franchise, and it was Senior Home Healthcare. We transitioned from that franchise, sold it, and started pediatric home healthcare. I gave a lot of reasons. One of the main reasons is I wanted to work with the beginning of life instead of end of life. And also the agency we worked in didn't allow us to build any form of Medicare or Medicaid. So getting paid was really hard because we only relied on personal financing or primary insurance. So building this pediatric home healthcare agency allowed me to get certified through Medicaid, which is a state-funded program. Medicaid certification isn't as complicated as some people think it is. A common theme you'll find in my businesses is I like to do my own paperwork. It's not that I don't want to pay anybody else to do it. It's just that when I do the research, the cost of paying somebody else and the time it takes for me to do it, it just doesn't balance out. So I do my own research. Every state has a manual and regulations that they tell you have to follow. And if you download that manual, it tells you the exact documents you need in order to become certified by the state. And those documents will range from your policies and procedures, your staffing requirements, your document retention requirements, and it will list exactly what those requirements are. I literally went through that policy and I built documents based on what they needed. I submitted those to the state. I got all the qualifications that I needed, business insurance, fingerprint background check, and it was a $750 fee from the state of Georgia. I submitted that. The state came out to do an audit. Basically, I needed an office. I needed 2 locks for documents, which basically means a lock on your door and a lock on a filing cabinet, or a lock on your door and a lock on your computer. It's just 2 forms of security. So in that audit, they just want to see your paperwork. They want to see that you have policies and procedures. They want to see how you're going to be retaining those documents. And I presented all that. And I got my state certification to be to build Medicaid for the program. Basically from there, I kind of thought I needed more help. So we hired a consultant. That consultant cost me $4,000 up front and $750 a week starting from the first client she got me. The main reason I hired this consultant was because I thought I was going to need help getting clients. I didn't have a name in the industry. I was new. I was not a nurse. I had not previously been in healthcare. And because she had all those credentials, I figured, okay, she's going to get me all these clients. So again, remember, the $750 a week didn't start until she got me my first client. I started this process in 2019, November or October. March, she got me my first client. Baby still in the hospital, just born, about to be discharged. So now the $750 a week starts. That baby was not discharged until August. So between March and seemingly August, I'm supposed to pay $750 a week. Mind you, I don't know an exact discharge date. So every week is going by and the baby's not discharged, not discharged, not discharged. And in that time, she's saying, I'm going to get you more clients. More clients didn't come. So by the time August came, I don't know the number I'm going to throw out. I'm not even going to throw out a number. I'm just going to say, calculate March to August. It was a lot of money we paid. And I just said, I can't do this anymore. She had brought me 2 more clients that weren't out of the hospital yet. So my lesson from that was ask more questions. And sometimes you don't know the questions to ask because, again, I thought the baby was going to be discharged. The baby was not. So now I'm paying $750 for this consulting service. Anyways, I went on to do things myself. I went on to build a name for myself. I contacted hospice agencies. I reached out to hospitals and clinical staff. I sought out anyone in the medical pediatric field that I could say, hey, I do this. I provide home health care services. And once I started getting my name out there, I started getting calls. I started getting emails offering clients. Another thing I had to do was staffing. Again, this was referenced in the previous episode where I discussed how I hired a nurse for one of my clients this was the senior care business. I hired a nurse for that client that didn't show up. So I actually had to go show up. She was a CNA. She wasn't a nurse. And since she wasn't a nurse, I could go fill that role. It was cleaning the house, cleaning the bathrooms, things like that. In pediatric home health care, I couldn't necessarily do that. So hiring nurses is essential. I take care of kids with trachs, G-tubes, vents, things like that I'm not qualified to do. So when nurses would call out or wouldn't go to work, not only did we lose money, but we lose confidence with our clients because our clients aren't just the child. Our clients are our parents. And now that parent either can't go to work or they can't fulfill other obligations that they already had in place because they thought a nurse was going to be there. So that weighs on our reputation. So hiring reliable staff is paramount to building this type of business. And you're going to go through staff. Staff retention is one of the biggest issues in home health care, be it senior or pediatric. Keeping nurses and healthcare staff is an issue that not only people in our industry have, but major hospitals and nursing homes have. Nurses have their pick of the litter. They can work at a hospital, they can travel, they can work in a home, and they use that. They go where they want to go when they want to go. And sometimes that can leave you in a bad situation. So you have to hire nurses that are reliable. You have to review resumes and look at previous places they've worked. How long have they stayed there? You have to call references. That is one thing that I did not do. I read a resume. I looked at credentials. I verified licenses and certifications. I did not call references. And sometimes it was detrimental to my business. Financing and funding. Having money to just put an ad on Indeed is important. I have spent thousands of dollars running ads on Indeed just to hire one nurse. However, that nurse has worked with me for 5 years. So you can't be afraid to put money into recruiting. I haven't spent a lot of money on marketing because a lot of my marketing is word of mouth. A lot of my parents refer me to other parents. There are networks of parents with medically fragile children, and they share your name, good, bad, or ugly. They share your information. So these are just a couple of things that I stumbled across when building my pediatric home healthcare agency. One, getting your paperwork is not as complicated as some people make it seem. Download the requirements and the regulations, put them into place in your documents. 2, auditing isn't as big of a headache you would think as long as all your paperwork is in order. 3, I wouldn't necessarily pay a consultant. I would go out, make a name for myself, reach out to healthcare staff and let them know who I am and that I'm in the industry. And 4, staffing is paramount. Hire right the first time. I hear people say all the time, hire slow, fire quick, something like that. Like we slow to hire and quick to fire, basically. So I'm quick to let nurses go. I don't when it comes to children, when it comes to my parents, I I I don't play. So it's very important to me that my reputation is sound and my parents trust me. So call your references, call other people, find out what type of nurse this is, what type of care she's provided, and make sure you background check and check the people that you're sending into the homes of children and families. On the next episode, I'm kind of going to discuss how I've been able to grow the business. I'm going to talk about more staffing issues that I've had and how I've been able to make this $1 million business. So stay tuned for my next episode. And if you have any other questions about building a pediatric home healthcare agency, leave them in the comments. Thank you guys.